Now, this is such a major revelation, perhaps one of the most important findings in the Wuhan virus saga. And we couldn't have done this story without repeatedly checking this data and without speaking to the man who led this research effort. His name is David Robinson. He's a retired Australian Army intelligence officer. He co-founded Internet 2.0. It's the company that published these findings. David Robinson was the lead researcher on this project that shows that the Wuhan virus outbreak may have begun in China as early as May 2019, or at the very least, China had begun preparing for an outbreak in May 2019. And tonight, David Robinson joins us from Canberra in Australia. Mr. Robinson, welcome to WION.
Hi, and thank you so much for having me.
Your study, as we've been saying, is extremely significant. Your findings are very important. And this research focuses on how the procurement of PCR tests in Hubei shot up in 2019. Now, for almost 2 years, the world has been trying to answer the question of the origin of the virus without much success. How does your study, how do your findings impact that quest?
Well, it's very hard for us to determine, based off the current commentary and the data and all the investigations, exactly when coronavirus started, because we don't have a patient zero and we don't have key case data. So we've tried to use predictive statistics and third-party data in order to identify potentially when coronavirus might have started emerging. We're looking at people buying PCR equipment because they're potentially dealing with an unknown virus, an emerging epidemic in Wuhan, and they're trying to identify cases, what the virus is, and react in a normal way that any health system would react around the world. The key points are, in 2018, most of the PCR equipment was normal hospital and research use. And in 2019, it shifted dramatically to increase. And those drivers, those institutions that drove the growth, were from the Centers for Disease Control in Hubei province, significant growth from them, and the Wuhan University of Science and Technology. And key to this university specifically is they have 35 teaching bases and practices in the field. And this is not based off the websites of the other universities. This is not the same level as the other universities. So they've got teaching practices in 22 general hospitals and 10 Centers for Disease Control and Prevention. So these are the normal institutions that would be expected to deal with an emerging virus, an unknown virus. And that's where we're seeing the significant increase of purchasing of that equipment from in 2019.
Now, the most important revelation is the fact that the procurements began in May 2019. What are the significant findings from the papers that you have unearthed, and what more can you tell me about this?
So the procurement documents are all open source. They're all available on the internet, and they're all Chinese government assets or organizations purchasing equipment in general. This is all openly available on the internet. The significant increase really occurs in a window between July and October, and that's the bracket. But there was a significant purchase made by one of the CDC units in Hubei province, Wuhan, in May, and also by the People Liberation Army Hospital. That was announced on the 27th of May for one PCR laboratory piece of equipment.
I'm sure there'll be critics of your report, and this is one of the arguments that they could make, that PCR equipment can be used for other purposes too. PCR equipment has been around for very many years. How do you link these purchases to the Wuhan virus outbreak?
Well, there are significant reasons why to use PCR equipment, but the primary purpose is to amplify DNA in order to identify viruses. So if you want to identify MERS or SARS or swine flu, for example, in both human and agricultural purposes, you're going to use PCR testing. We looked at the data and saw there was a significant correlation in a significant increase in 2020 purchasing and a significant increase in 2019 in Wuhan province. So yes, PCR equipment is used generally, but there is a direct link between the significant increase in PCR equipment and potentially responding to an unknown virus or COVID-19.
Now, the Chinese Foreign Ministry, we know, has already dismissed your study. How do you respond to that?
Well, we've only used Chinese data. We haven't used anyone else's data. We've used their information in order to build our data set and our study. And secondly, more transparency builds trust. And there's been a lot of commentary around the world about the lack of transparency, the lack of ability to access data, the lack of ability to identify a patient zero, and the lack of cooperation in all those international investigations conducted. So we would love to see what the patient zero is. We would love to identify the zoonotic origin of the virus, but I don't think we're actually going to be able to find that just due to the lack of data being presented by China to the world. So all we can do now is use predictive statistics and third-party data points in order to box around the potential answer to all the public's questions, which is a global public, really.
David Robinson, thank you very much for joining us here on WION.
Thank you so much. Thank you. Appreciate it.
WION is now available in your country. Download the app now and get all the news on the move.